Kathy and I, we have a very special award to present to you, to a dear person who we have known for 20 some odd years and have worked together on the fetal alcohol spectrum disorders issue. Elizabeth Dang is someone we work with very closely. And we don't always just get to acknowledge how grateful we are for having the opportunity to work together. She is at the Centers for Disease Control and Prevention. She has not only a wonderful custodian of all of our resources as taxpayers, is personally invested and believes in this cause and is dedicated to it. And so we're thrilled to be recognizing her tonight.
Elizabeth, you're always on point. You pay attention to details, but you have a very gentle way of getting problems solved. And we both admire you greatly and really enjoy working with you now, and look forward to working with you in the future, and have loved all the years that we've worked with you.
Indeed. So Elizabeth Dang is this year's recipient of the NOFAS Excellence Award.
Thank you so much for that introduction, Kathy and Tom. I think when Tom and Kathy called me a few weeks ago to tell me that I was chosen for this award, I was actually speechless, and now I might be even more so after that introduction, so I'm glad I had prepared a few remarks. But I always feel like the most rewarding work that we do is that which gets us closer to the families and the audiences who we're actually trying to reach. And sometimes that link is really not so obvious in the work that we do. But because of our work with NOFAS over the many, many years, I think you all made me even older than I am by saying it's been over 20 years, but it has been many years, and I feel like working with NOFAS really does give us a closer connection to the audiences that we're trying to reach. So I feel privileged to have worked with them for so many years, with Tom and Kathy and Andy and many others who've been at NOFAS over the years, and also with the NOFAS affiliate network across the country, some of whom are here tonight. And I just feel like working with partners like NOFAS and others who are here today really does, for those who have so much passion for this issue, that really is a highlight for me, both professionally and personally. So at CDC a few years ago, we released some communication materials that were trying to raise awareness around the risks of prenatal alcohol exposure and FASDs, and at the time we asked Kathy Mitchell if she would provide a quote for the brochure. And she did, gladly, and it reads, "In over 20 years of working on FASD prevention, I have never met a mom who intentionally wanted to harm her unborn baby. Either she didn't know that alcohol was harmful during pregnancy, or she needed help to stop drinking." And I often think about this quote, not only because it was so important to have Kathy's voice in that piece that we developed, but because I feel like it really does sum up the work that we do. So either a woman was not aware of the risks, or in many cases, she needs help to stop drinking. And so how can we get better information out to women and their partners? And one way that we do that at CDC is working with healthcare providers. And we're working with many different types: OBGYNs, pediatricians, family medicine practitioners, nurses, medical assistants, social workers, because they really do each have a role, not only individually, but also collectively as an interdisciplinary team in the prevention, identification, and care of fetal alcohol spectrum disorders. And so then we also want to make changes at a larger system level. So for the past several years, we've been actively trying to promote the implementation of alcohol screening and brief intervention, or SBI, as routine primary care. Alcohol SBI is recommended by the U.S. Preventive Services Task Force for all adults who are seeking primary care, and that includes pregnant women. And it's intended to be routine, just like checking blood pressure measurement. And if SBI with one's healthcare provider could truly become routine, just like talking about diet or exercise, it really could help reduce risky alcohol use, including preventing alcohol use during pregnancy. So related to Kathy's quote, going back to her quote, it could get a woman the help that she needs, either to realize that any amount of alcohol during pregnancy could be harmful, or to get referral to treatment if she needs more than a brief intervention. So standardizing the use of this in primary care could also really help reduce stigma around this issue. And that brings me to the wonderful work that NOFAS has been doing around reducing stigma related to prenatal alcohol use and FASDs. And Kathy, as a national and international spokesperson for this topic over more than 25 years, has really had immeasurable impact. And NOFAS's work creating the Circle of Hope to support birth mothers of children with FASDs, and a Speakers Bureau of birth mothers and people living with FASDs and family members, and their constant work to get information out to the public really does give a voice to this topic. And at CDC, we are thrilled to be able to support the expansion of the NOFAS Speakers Bureau. So every one of you at this event tonight is a champion for FASD prevention and intervention and care. I'm so grateful to be part of our team at CDC that works on this. Our CDC Division Director, Dr. Peggy Honane, is here tonight, here at this front table. So thank you to Peggy for all of your support for this work, both for recognizing its importance and also to be able to amplify the voice of our partners like NOFAS. And of course, none of us can do this work alone. So I'm really honored to be here with all of you, to be part of our CDC team that does this together. And I look forward to our work moving forward in this very important issue. Thank you so much.